Trust is the cornerstone of any health system. The patient is coming to you for their own care. And so that information in there is deeply personal and has to be protected. Health systems that ignore protecting patient data is really doing a disservice to the patient. And once that you break that trust, how can the patient come to you?
It's very important for the consumer and the patients to know that their data is being accessed for clinical treatment only or for a reason that they want to share the information.
Health information is considered more valuable than most other, consumer information that exists, right? So we know it's valuable. We know that there's bad actors that are trying to get their hands on this information and utilize it to, to submit faulty claims, to steal identity, whatever that happens to be. So when we talk about, those bad actors, they keep changing, right? They keep changing their techniques. You've got to stay up with it. It isn't something you just set and you're done.
It's important for providers to know that the network that they're getting their information from is hyper vigilant about security because they need to trust the data that they have in their system.
If you don't trust the information that's being presented in front of you, how can you act on it, right? You'll always have this sense of doubt or concern that what you're seeing is not truly representing the patient nor accurate, especially if you're concerned about tampering.
If you can't trust that information is being protected, that information isn't even going to flow. Without a high level of trust, our network doesn't exist. Everything we do, we look for multiple layers of security. It's not just one layer of security to protect information. It's defense in depth, as you might say, right? If someone understands how to crack through one layer, there's another layer they have to go through. Plus, it's not enough to do that and just know you're doing that internally, but you have to have external oversight. Our first audit we went through and actually passed the first attempt, and that was with an organization called ENAC. And since then, we've added on so many other accreditations. We were ISO accredited. We've now transitioned to High Trust, which is even more sophisticated than we had with the ISO certification. We've done SOC 2, which is another security type of audit. And we also are Web Trust certified.
We've worked with Surescripts now probably for over probably close to 15 years. So that track record, because Surescripts has been able to demonstrate reliability and trustworthiness, I don't think anyone in our organization for a minute doubts the integrity and the data that we're getting from Surescripts.